We found out that there is still quite a bit of debate as to what is the real impact of the use of a biomarker, and that even though there is a growing interest in precision medicine, many clinical trials still don't use a biomarker to select patients. So what we've done is that we've looked at the literature into PubMed, and we've extracted the data from 13,000 patients about studies published between 2011 and 2013, because we were really trying to extract the information about a large data set in order to assess the impact of the use of a biomarker. And what we found is quite a stark difference between trials that used a biomarker versus trials that didn't use a biomarker to select patients. Indeed, the median response rates for studies that used a biomarker was 31% versus only 5% for studies that did not use a biomarker. And we also saw a stark difference for the progression-free survival, or PFS, which was 5.7 months for trials that used a personalized approach versus a little bit less than 3 months for trials that didn't use a personalized medicine approach. So this is probably our main finding, I'd say. But I think that there are two other things that deserve to be mentioned here. So the first one is that, so there is often a question that is asked, is this about testing better drugs? And our study also showed that if you use a targeted therapies without a biomarker, you're going to have very low response rates, about only 5%, which is actually really close to what you're going to have with a chemotherapy agent. And lastly, when we were comparing the type of biomarker, so within personalized trials, so both a protein and a genomic biomarkers led to improved outcome, but genomic biomarkers performed better with response rates of 42% versus 22% with a protein biomarker.